Starting right now on ABC's This Week. Out of control, the Ebola outbreak spreading fast. And now, the race to save 2 Americans stricken with a killer virus. This morning, breaking details on the emergency mission to bring the first patient home. Border bedlam. No action from Congress on a surging humanitarian crisis. Our reporter on the ground with the dramatic impact on the Border Patrol and the families still crossing over. Then,
she is gone!
Remembering baseball's biggest moments.
It gets through Buckner!
With the legend who brought so many of them home.
Time for Dodger baseball!
From ABC News, This Week with George Stephanopoulos begins now.
Good morning. It's an image sparking hope and fear for so many Americans. Christian missionary and Ebola patient Dr. Kent Brantley back in the U.S., walking into Emory University Hospital Saturday, then reuniting with his wife through a glass wall. ABC's Bazi Kanani starts us off with the latest on this extraordinary operation to bring Brantley home.
Dr. Kent Brantley arriving Saturday, the first Ebola patient on U.S. soil, whisked through Atlanta by ambulance. Then, that's him on the right in a full biosuit, walking with assistance into a special isolation unit at Emory University. A 5,000-mile trip from Liberia on a jet modified with a protective tent to prevent contact with bodily fluids, which is how the killer virus is spread. Officials say they're confident his treatment and that of his colleague, Nancy Wright-Bull, who will arrive in a few days, won't put the public at risk.
We do not believe that any healthcare worker, any other patient, or any visitor to our facility is in any way at risk of acquiring this infection.
Meanwhile, in West Africa, the biggest Ebola outbreak in history, already called out of control by aid groups in Liberia, Guinea, and Sierra Leone, is only getting worse. More than 700 dead so far. Governments reacting with drastic new measures, soldiers on the streets, disinfectant sprayed in public places, and schools closed.
What is the situation there on the ground in Liberia?
Well, quite frankly, the situation is dire. Our healthcare capabilities and capacities are truly overstretched and overtaxed.
Here, protesters plead for bodies to be removed, then a standoff when sick people in this home refuse to be taken to an Ebola treatment center. Back in the U.S., 20 quarantine stations are ready in case infected travelers arrive. And caution in Washington, where participants arriving from the affected countries for the U.S.-Africa summit will be screened. Authorities on alert should another case of Ebola turn up unexpectedly. For This Week, Bazi Kanani, ABC News, Washington.
Our thanks to Bazi Kanani for that. And joining us now from Atlanta, the head of the Centers for Disease Control, Dr. Tom Frieden, and our own Dr. Richard Besser, also a veteran of the CDC. And Rich, let me begin with you. Tell us a little bit more. You've been inside that isolation chamber. Tell us a little bit more about it and what the prognosis is for Dr. Brantley right now.
Well, you know, Dr. Brantley was supposedly very ill when he was in Africa, but seeing him walk out of that ambulance is a very positive sign. I've spoken to one of the doctors who's on the team that's taking care of him. There are 4 infectious disease specialists, 2 highly trained nurses. They'll be wearing that same kind of protective gear that we've been seeing to take care of him, but they'll be able to monitor him much closer, give him fluids, give him blood transfusions, give him the kind of care that was not available in Liberia.
And Dr. Frieden, as you know, a lot of anxiety here in the United States about the spread of Ebola, whether we're taking an unnecessary risk. I want to show a tweet that Donald Trump put out just the other day. He said that the U.S. must immediately stop all flights from Ebola-infected countries or the plague will start and spread inside our borders. Act fast. How do you respond to that?
Well, Ebola is scary, and it's understandable that with a deadly disease, people are concerned. But the plain truth is that we can stop Ebola. We know how to control it. Hospital infection control and stopping it at the source in Africa. You know, we're not going to hermetically seal the borders of the U.S. We're reliant and interdependent with the world for travel, for trade, for economy, for our families and communities. But really, the single most important thing we can do to protect Americans is to stop this disease at the source in Africa.
But Dr. Frieden, is it safe right now to send CDC workers into Africa?
Well, we are surging our response, and we're going to put 50 staff on the ground in these 3 countries to help stop the outbreak in the next 30 days. And we put safety first. staff have experienced some hostility from groups that are so upset, we immediately withdraw them. And we make sure that if we're taking care of patients with Ebola, we have the proper gear so that the risk of infection is kept to the absolute minimum.
And Rich, there is a concern if the world is responding effectively to this crisis, which is spreading throughout West Africa right now.
Yeah, I mean, there's a big concern. The World Health Organization put out a plan, a statement that $100 million are needed to control this. I've talked to public health experts who say that that's a gross underestimate of what it will take. Public health traditionally lowballs the figure. But there are two reasons. There's a humanitarian reason for stopping this in West Africa, but the conversation we've been having also shows we have a self-interest in doing that. And the conversation really has to look at what will it take to beef up the health system to control this where it is.
What about Dr. Frieden and Ebola vaccine? I know the NIH is planning some human trials in September. Is there promise there? And what's the block to getting it out more quickly?
We would love an Ebola vaccine. It would be very helpful, especially to protect healthcare workers. But even in the best case, it's a long way away and it's uncertain. What is certain is that we know how to stop Ebola now. And really, the tried and true public health mechanisms work. You find the patients, you isolate them, you find out who their contacts were, you trace the contacts, you track them every day for 21 days. If they get fever, you start that process again. You make sure there's good infection control, and you educate the community in Africa about safe burial practices. When you do those simple things, Ebola stops, as every previous Ebola outbreak has been stopped. But right now, it's out of control in West Africa, and it may well spread further in that region. What we can do, and what we're doing, is surging our response to put out the embers, because Ebola is really like a forest fire. If you leave one ember burning, it can flare up again. That's why it's so important that we control it.
Finally, Rich Besser, the Nobel Prize-winning biologist Joshua Lederberg recently wrote, "The single biggest threat to man's continued dominance on the planet is the virus." Are we doing enough to address this broad threat of viruses?
You know, I don't think we are. I think we've been far too much in a reactive mode when it comes to new emerging infections. There has to be a much bigger approach, a much bigger effort to try and look at where will the next virus emerge and how do we be prepared for that wherever it may occur.
Okay, thank you both very much.